Good morning. Can I draw the meeting to order? Can I have apologies in order of business?
Apology from Councillor DeVink, Chair, and the order of business as published.
Any declarations of interest? Thank you. Minutes of the meeting of the 20th of January for approval. Any matters arising? Are we happy to approve them? Okay, thank you. Performance reports, item 5, health and social care, adult social care. Alison.
Thank you, Chair. We'll give a quick rundown of some of the highlights of the report and then happy to take questions at that point. Start with integration. There's been an awful lot of progress been happening with integration, particularly around the integration scheme. At this point it was out for consultation. We've since received the consultation responses. There's been no major changes required to the integration scheme. I think we were surprised by the number of people who'd responded. It's quite a long, technical, dry document, and I don't think we're expecting the volume of responses that we got, so we were pleasantly surprised by the number of people who'd engaged in that process with us, but no significant changes to what was required within that. And again, the strategic plan is in place, and we're currently looking to pull together a strategic planning group that covers across health and social care, ensuring that we've got good user, carer and staff representation around that as we develop the plan going forward in conjunction with the board. With regard to older people's services, we are at the very end stages of our retendering exercise for care at home services. Just a reminder that this was particularly around domiciliary care. We were clear within the retendering process that what we were looking for was for the providers to pay the living wage, to ensure that people were not on 0 hours contracts, and to ensure that travel time was paid for carers. So it's a real shift in terms of ensuring that for such a large portion of the workforce that we've got a really valued social care workforce, because the value of the social care workforce really does lead into the kind of quality of care that we can expect for users and carers. So that new contract is due to pick up from the 1st of April. So we're currently doing that transition period between providers, and there's a lot of work going into that to ensure that everybody knows who their new care provider will be and what's happening. 2 of our existing care providers were successful as part of the retender, so there's minimal change in a couple of areas, but in the west of Midlothian there has been a change in the provider there. So SCRT will no longer be providing, and MEARS is a new company that's coming into our area. The Enhanced Rapid Response Service, we've fully staffed that now, which means that we have a geriatrician who's working in the community, and we have some advanced nurse practitioners, which means that we're actually more able to provide a hospital at home service, which really helps us in meeting some of those targets around delayed discharges, ensuring that both we're preventing admissions to hospital, but also we're able to bring people out earlier and give a level of support that previously has only been available within hospital. And as you know, most people do prefer to be able to remain in their own homes and be supported in that way. Self-directed support continues. There's been some really positive work going on, as you know, from the members' seminar that we had in terms of some of the development that's been happening in that kind of area, and that work continues. In part because of some of the retendering exercise, we're doing an awful lot of work at the moment around option 2, as there are some people who are subject to the retendering who actually want to take a different option than they've had at the moment and take a bit more control over their budget. So there's an awful lot of work going on around the option 2 for people. We were successful in getting a bid for transforming care after treatment for cancer. So there'll be an intensive piece of work. There are a number of people living with cancer within our community, and it's about finding better ways of supporting them to live with that condition and to support through that from following diagnosis. Probably nothing else wanting to pick up particularly within the highlights other than what's there. In terms of some of the challenges and risks, as you are aware, there have been some issues regarding high sickness levels and funding pressures within care homes, particularly within new buyers. As I think Evelyn had highlighted at Council, it wasn't going to be a quick fix for us to make the changes that were required there, and we need to ensure that we had sustainability for that service as we move forward. There's been a really intensive piece of work undertaken that's involved HR colleagues, learning and development colleagues and finance colleagues for us to do a real dig down and look at what some of the issues are, particularly around some of the cultural issues. A lot of that work has been undertaken, and we're finalising some of the report and beginning to look at the really detailed action plan, and we propose to bring that back to a following meeting. Some of the highlights from that have been, I think one of the positive things has been the commitment to care that has come across from staff in terms of some of the work that's going on there. Issues around the changing environment, there are increasing levels of care and support that are required, and how we can best support staff in their changing roles to meet the needs of the people that we're supporting. A real need for us, I think, to refocus the management, both in terms of the clinical and staff support that we offer to people in terms of the care they're offering, but also that business management element of running a care home and what is a fairly substantial staff group. Interestingly, from most of the staff group, they were keen to see a more robust approach to sickness management as well, so we're working alongside staff to do that. During this period, we did get a care inspectorate report for new buyers, and the grades have increased within new buyers, so certainly the quality of care isn't being seen as an issue from the care inspectorate, despite some of the challenges that we're facing. We've seen fluctuating absence levels since the New Year period, although they are heading in the right direction, and we are seeing a reduced overspend position, but it's still higher than we would want to be seeing at this point in time. In terms of external provision, we've got currently 2 care homes that are subject to large-scale investigation. We are seeing significant improvements in both of those care homes and hope to lift both the large-scale investigation and the suspension of admissions at the end of this month. If there's anything else, I've just opened for questions.
Thanks, Alison. Jim?
Can I just ask a daft laddie question at the beginning here before we get into the nitty-gritty of the reports? And it's a general question across them all. If you take, just go to the first, page 8, at the top of the page, all the columns are described quarter 3, 2013, and then it goes on to quarter 1, 14. Is there something wrong with all these reports? Where's quarter 4? I've noticed that, and I only noticed that, I would have asked the question, but I only noticed it just before I came in here. Am I missing something, or is that incorrect?
Chair, yes. What you have in these columns is you have on the extreme left the 13-14 final outcome, and then next to that you have the quarter 3 for 13-14, and that is simply to enable comparability with quarter 3 this year. Has it always been like that? I'd be less confident about that, but that's. I think what we normally try and do is we give the overall picture for the previous year, and we also give the same quarter in the previous year, so there's that comparison with the equivalent period in the previous year.
Sorry, you might get I can't find a quarter 3 in here to compare it with. You've got quarter 1, you've got quarter 2, and you're going into quarter 3 into the next one.
But that's quarter 3 for the previous year. That's overall performance.
Okay. It then begs the question why there's a pile of information still missing for quarter 2, which we'll come to later on. Okay, that you, Jim. Brian.
Chair, I've got a few questions and points I'd like to be further explained to me. But can I just firstly talk about new buyers? Because of the critical situation that developed here, we were given timelines and we were given reassurances that we'd be getting weekly kind of updates. And the last information I had was this major report was going to be ready by the end of February. Just if you could just tell me about the slippage in that, you know, and what happened to the weekly reports on the kind of absence figures that both myself and Councillor Young were particularly interested to see.
With regard to the slippage for the report, in part it's because of accessing all of the staff. The approach that we've taken, it was a cultural audit, and what we needed was all staff to be involved within that. In part because of some of the sickness absence issues, that has proved difficult to get all staff, and it is a large staff group with a fairly significant role. It is difficult to pull staff out of that without incurring additional costs to cover the shifts. So in part that has been to get all of the staff available at the right time to pull that information together. Because of the nature of the report as well, we were really clear that before the report went significantly further that we needed to do that engagement with staff. This wasn't a one-off that we do the report, we write an action plan. It's about that ongoing engagement. We actually need all of the staff to be signed up to an action plan for it to actually work. It's not an action plan that only I, myself or Evelyn can own, or even the manager of the service can own. It needs to be something that all of the staff are committed to. So there's a further piece of work that we need to do. So there's a draft stage of an action plan, and over the next, between now and the end of March, there's a period of further consultation about sharing the report, developing the action plan with the staff. So I think in terms of the intensity of the work we've done, the report has taken longer than we had expected. With regard to the weekly updates, apologies for that, and I'll ensure that that's rectified. That's just been an oversight on the part, but I'll forward on the updated information, and that includes all of the information from the beginning of January, so you'll see the progress and ensure that that comes to you from now on.
Yeah, it was raised before in other meetings, and it's very critical, you know, and I'm hearing verbal reports that things are moving in the right direction, but I've not actually seen any documentation, you know, or evidence and that kind of basis, and also the financial question was the biggest question, you know, that was raised in that, you know, with the overspend situation. So I just want to see some kind of figures and some kind of report about we're moving in the right direction on this, and that we're actually tackling the major overspend, and it is major, you know, overspend, and any moves in the right direction would have been, you know, nice to see rather than just hear about. I'll go and ask a couple other points. Okay, on page 9 of the report, and the top two, the average number of working days lost due to sickness absence. Just wonder if you could report or update me further on that. But it seems to be on target, and the progress that's going there, and obviously that includes care homes staffing kind of figures in it, and there seems to be very little information about the performance against the revenue budget. There's some kind of quarterly values put into this report, but I didn't have any output kind of values that I could benchmark this with.
With regard to sickness absence, yes, that does include the care home figures within that. You will see that it is an increased position from where we were at Q3 in 13-14, but it is still within the target at this point in time. It is very difficult to maintain that with you being aware of the sickness absence issues that we have within our care homes, and the care homes are a significant portion of our staff. There's a really robust process that we take to managing sickness absence. There are monthly meetings with all managers who have staff who are off are absent at any particular time, to ensure that all of the processes and policies and procedures are being applied robustly, and that we track any issues, particularly around the long-term absence. So that's supported very well by HR. So it is a really robust approach that we take, but it is challenging for us to maintain the levels within that due to some particular sickness absence issues that we do have in a couple of our care homes. With regard to finance, what level of detail would you, is there something in particular looking at for that? Because obviously the financial report comes on a quarterly basis with the breakdown within that and the projected variances, and I don't have a copy of that in front of me at this point in time. I can broadly give you a breakdown, but it...
Well, just as it says, the information, the latest financial position will be reported to Council in February. I mean, obviously that's not been done.
My understanding was that the finance report did go to Council in February with the narrative contained within it. I wasn't actually at Council. Kevin, who's far more organised with me than his papers, does have a copy of that, so I can run through the figures if there's anything in particular you were looking for. But my understanding was that it was reported at the February Council.
Apologies, I've omitted that. I thought maybe it was this PRS kind of agenda. Can I just ask another couple on the... I've got page 5, the Adult Social Care Action report, and ASC S03.1. On the top point, in the second paragraph about black and minority ethnic groups. I don't know if you're aware of much of the changes of being involved with LREC recently. Edinburgh Lothian Racial Equality Council. But do you think this is maybe an appropriate time to be discussing with them a service level agreement of some kind to particularly address the issues of race? They are a long-established organisation, and they're ready and willing, I suppose, you know, and able, especially with the changes with the Edinburgh SLA calculations recently, and they've got the major contacts and expertise. And I just wondered if that was something on your considerations, or could be in your considerations. And if I turn over the page about the rapid response team, are they fully moved from S-Bank to Bonnyrigg?
With regard to black and minority ethnic carers, it has proved difficult, and certainly we're always open to have discussions with organisations if we think that we would be able to improve the services for people who are living locally. Certainly there has been some investment in funding in that area recently, but we're certainly open to having further discussions with other organisations. They're not an organisation that we currently work particularly closely with, but we certainly would be, it's MECOP that we tend to do a range of the work with, but we're certainly happy to arrange to have a discussion with an organisation to see what they may be able to offer for us locally. With regard to Merit moving, they moved on Monday. At this point in time, apparently phones are working, computers are working. We don't have access to voicemail at this point in time. But yes, it does appear that the move, everyone has moved, so we're now in the process of doing the refurbishment work that we need to in High Bank to reopen the 7 beds that we've got there. So that work's been scheduled and is kicking off as we speak. But yes, the move has happened, and people obviously take a little bit of time to settle into a new office environment, but so far so good with the move, and the technology has assisted us within that. Certainly both IT departments from NHS and the Council have worked really well together to enable that to happen for us.
Thanks. Just to go back to the long-term conditions, you know, for treatment, for care after treatment with the cancer kind of test bid. Just be interesting to hear a bit more about that, if you were able to speak to it in terms of what aspects of care, you know, start date for the project. It just sounded really, you know, quite interesting. Quite to hear a little bit more, if that's all right.
Happy to share the project documentation with you to highlight that in a bit more detail. It's the funding hasn't come through to us as yet, but it's a project really for us to work with people within their communities, really supported with Macmillan. Cancer isn't an area that we've particularly done an awful lot with. NHS have obviously taken a lead, and Macmillan do an awful lot, but actually in terms of support groups and how we work with people to more around some of the emotional aspects of the work that they do. Obviously we'll put packages of care in and support for people with cancer, and that we'll do aids and adaptations to ensure that we can support people within their own homes, but it is more around some of the support for them and their families with dealing with that condition. But very happy to share a copy of the bid that we put in and the project plan in terms of how we enable that to happen, and I can do that certainly.
Yeah, Councillor Young, I'm willing to share a lot of information on that with you as well. I've met with the Macmillan project worker, you know, and had good in-depth discussions, and I think it's great that the funding situation and a lot of the in-kind contributions that Midlothian Council gives to this project is on place and continuing. And I think it's a very valuable service to many and to some of my constituents who have benefited from it as well. On the Caledonian project system, it's propping up on a few different pages, but on page 13, on point 07.4, a women's worker is now in place following a 2-month vacancy. Can you tell me a bit more about the Caledonian project as such, and this women's worker, and is it based at Women's Aid or is it based somewhere else? And how long term is this Caledonian project, and what's the funding criteria for this organisation, and how long is it likely to continue?
Caledonian project is longish, long. I can't remember how long the project funding is, but it's a fairly long-term post, and it's based within our criminal justice service. So it's based here within Dalkeith. So it's about supporting women offenders primarily. So very closely linked in with the Spring project that we've developed recently that's within Dalkeith Arts Centre, which is supporting women who have issues with offending substance misuse services and domestic abuse, very linked in closely with the rest of our public protection team, but is embedded within our criminal justice service and is long-term funding that we get Scottish Government funding that's very specifically ring-fenced around working with women offenders.
Thanks, Alison. Jim?
Yeah, just on page 7, in the progress section of the report, the top part, you're talking about the partnership continuing to meet the national delayed discharge targets. But then in the challenges further down, we're talking about acute hospitals are facing severe delayed discharge pressures and there's increased demand to meet those needs. How, you know, looking ahead a bit here, I mean, these positions are getting worse, and while we're maybe meeting targets, are we, you know, are we seeing real pressure? How severe is that pressure? And how likely are we able to respond to that going forward? And the other question I've got is on the next page, page 8. And this is no peculiar to your particular service, but the issue of complaints being resolved within complete within 5 working days are particularly low in that Q3 at 31%, where the target is 95%. Now, you indicated technical problems. I take it these technical problems are right across the board, but why in particular is this one so particularly low? And maybe no for you to answer, but what are these technical issues that we're seeing here that's causing, I take it, is causing this right across the board?
I'll take the complaints question first because that's probably a quicker answer. One of the issues with why the target is so off is that social work complaints we have 20 days. So we do use the same system, but a social work complaint has different time frames to complaints across the council generally, and one of the recording issues that they've been put in is because of how it's being recorded as a 5-day, but within the complaints process for social work, it's a different complaints process broadly, and it's a 20-day target, which is why we rarely, if ever, will meet a 5-day target because of the nature of the complaints that are coming in. Doesn't mean to say that we never complain to something within 5 days, but that may be part of the reason why the target is so off. With regard to some of the technical issues, I'm not aware of what all of the technical issues are, so maybe I'm not best placed to answer that, but I think it's about where they're being allocated to and where that's being sent to. So, but part of it is to do with the processes regarding whether it's a 20-day or a 5-day complaint, and social work have 20 days to respond.
Yes, certainly, Chair. There were system problems, which is why it's reflected across all of the complaints reporting for all services in this quarter. I can assure you that that's been rectified. The basis of that was the recent structure changes to various services had not all been captured within the reconfiguration of the new services, and that caused difficulties in the reporting being captured and reported appropriately, but that has since been sorted and should be reflected in the final quarter for this year.
Is that no something on that issue here? Is that no something, given if social services are operating to different timescales, should that not be reflected in some way in these reports rather than it looking that bad when it really isn't? You know, when in terms of the targets, is that another technical issue that's going to cause problems elsewhere?
I would accept the point made. Whether it has that impact, I'm not aware, but I will find that out and come back to Councillor Murray because it sits within my service remit.
With regard to delayed discharge, targets currently, as you're aware, are 4 weeks. From the 1st of April, the target that we have is 2 weeks once someone has been deemed fit for discharge. And the recent announcement by the Minister and the new monies that are coming out towards us for delayed discharge are aiming towards a 72-hour discharge target. No date for when that 72 hours comes in force has been set as yet. We invest an awful lot of time and resources into managing delayed discharges. I think it's a reflection of some of the things that we do really well within Midlothian that mean that we've been able to successfully hit the targets. So our rebalancing care agenda, the fact that we've moved away from a reliance on care homes the good relationships that we do have with the care homes in the local area around ensuring that we do get placements when we require them. The really good work that our reablement service does to ensure that we've got good packages of care and the flexibility that our staff within those services offer to ensure that we get people out as quickly as possible. There are challenges for us, certainly at this point in time with the retender. There's an awful lot of investment going on to ensure that staff and existing service users are transferred over, but the only way we can maintain that throughput in our reablement service is that they hand over to the external providers at the 6-week point. That always remains a challenge for us to ensure that that happens. Capacity within the workforce, actually recruiting carers, that's part of the reason as part of our retender that we've looked at living wage and moving away from 0 hours contract, because what we need is a really sustainable workforce to support people at home. So yes, I suppose that's why you get it's a success, because we're managing it at this point in time, but we're not naive enough to think that we've entirely got this cracked or that it's not a challenge for us to deliver. It's piece of work that through integration, hopefully we're finding some really positive ways to think about things creatively, and the next bit of work is how do we move towards that 72 hours, how do we maintain that 2-week discharge target, which we have been over the last few months, but the level of investment within that is really challenging, and how do we move that to the next step. So I suppose it's about praising what staff are doing at this point in time to meet it, but wanting to recognise that this is not an easy issue for us, and with the demographics and with the pressures. But within the hospitals locally, in terms of talking about some of those pressures, actually the Royal Infirmary isn't just Mid Lothian people, there are East Lothian and Edinburgh, and the challenges within that we face, as not all of the partners locally have been meeting the targets.
Yeah, I just wanted to comment briefly. Members might recall that when we had the external auditor's report come to council in December, one of their comments was about performance management, ensuring that members in particular were getting the right information in front of them, was relevant information. This is a discussion I've sort of begun to have with Alison, that in terms of the amount of resource and the amount of focus that there is on delayed discharge. I mean, it's currently a target for health, but in fact, given the outcome, the result is to a large degree a measure of the work being done in social work. So one of my the views I've expressed is perhaps going forward with next year's report, so we move into the new year, actually delayed discharge is one of the things we should have in front of you, so that it's something you can see what the pattern of performance is and ask any questions in the back of that.
Russell.
Thanks, Chairman. Just actually coming on the back of what the Chief Executive said, but in particular what Councillor Moorhead's question was. A number of years ago, I asked the question about, with regard to bed blocking, about how is it that we can't do a deal? And I'll say that quite openly, because it would have to be a financial deal between the health service and the council regarding bed blocking, because it costs the health service X amount of pounds per week to have somebody in a bed in a hospital. Yet, if you were to get them out, they make a saving, but we can't do it because of the financial pressures, plus putting care packages together that suits that individual. And I was looking for somewhere where we could, they keep 2/3 of what it costs and we get a third financed into us, so we can actually pick up on the very thing that both Councillor Moorhead and the Chief Executive are talking about now. I then come on to the question. We've gone for an integrated post between health and social care. It seems to me that the director sitting at the top of that and the people underneath, surely between the two of them, and bearing in mind it's part of a community planning partnership agreement, that you could actually start to move money, resource, from the hospital side of things, the health side of things, into the community and try somehow to improve what we can do at that level. Because I'll tell you, 72 hours is actually pushing, I would think right now, a very, very blocked door, because I just don't, we're struggling to keep up with 2 weeks, but coming to that, I just begin to wonder if we can. My second question is, and I don't necessarily want, if you can't answer just now, Alison, take it away and ask the director what moves are afoot to try and ascertain if we can do that. The second thing is on integration. A lot's been said between health and the social care at the kind of high level, but as we all know now, medical practices in the localities are taking on more and more responsibilities. We have a nursing unit within a number of our medical practices nowadays. How do we, as a council, integrate with the health practices in communities in order to have a joined up agenda to working with the very people that need and deserve that care?
I like the easy questions, certainly, that you've saved for the end, which is the easiest of those to start with. The integration, I suppose the integration board will have a joint budget. So the budget will be the money that's currently sitting within adult social care and the money that sits within the CHP. But part of the money that's part of the IJB also includes the funding that we currently have for acute beds. So actually, I think as we're able to evidence that, I think it's the best opportunity that we have to see some of that movement between the health and the social care budgets, as it's just going to be one budget as we move forward. But I think also as we to look at the reinvestment as we really do look at more localised services. So be that less people using Liberton Hospital, more people using Midlothian Community Hospital, be that less people accessing the Royal Infirmary and how we can pull the money back out of that. The difficulty is that you're not going to completely lose beds in the Royal Infirmary, so how do you do some of that investment? But I think there's really good examples in Midlothian of how we've done that in the past. If you look at the changes that we made to mental health services when we closed Roslyn Lee, and the significant investment that was made in the community to ensure that we used reduced beds, and actually we still have one of the lowest bed usages of mental health beds across Scotland, and that has been because of being able to evidence that real investment in community resources to keep people at home. So I think we've got good examples of that already having worked, and I think the integration agenda probably gives us one of the best opportunities that we've got to do some of that reinvestment. I think in terms of the 72-hour target, I think it is probably achievable for care at home packages. It becomes far more challenging if somebody does require to go into a care home, because to be fair to somebody, to allow them to check what all of the care homes look like, to be clear that it's the right decision for them, that people have had an opportunity, families have had an opportunity to visit to see that they're happy with the environment, is a longer process. So we will need to come up with solutions about how we manage that process. The care at home, I'm not saying is easy, but is probably the more manageable bit within that, and we need to look at good ways of supporting people to make the right choices if care homes there, but that is going to take longer than 72 hours, so how do we manage that in a really productive kind of way with people to support them? And is that we use resources in a different way, so actually you move to an interim placement, because actually you get being assessed within a hospital environment, an acute setting, is very unnatural for people. It's a very different environment, and how you manage as an individual will be very different there than it might be in a care home environment. Somewhere like Highbank, which has all of the rehabilitation and assessment facilities within there, might be a good place to actually see whether or not care home is the right option, or whether or not move home is possible with a little bit more intensive rehab. So there's different ways that we're exploring, but you're right, 72 hours is challenging, and we will need to think very creatively about how we manage that. With regard to GP practices, the clinical director, who obviously manages the GP practices, is co-located with us over in Fairfield House, and is part of our joint management team. There's an awful lot of work that's been going on around consultation and engagement events with staff more broadly, and the next round of those that are set up are all being based within GP practices, and we're looking at much closer ways of working alongside them within that. I think we've got better working relationships with GPs than we've probably ever had. This has been a real push from their side and from ours to look at new ways of working and different ways of exploring. Obviously, there are pressures that are coming up from GPs, particularly around the sort of quality of some of the surgeries in the areas, the access to appointments, some of the signposting on, and there's a lot of work and investment that's going on, and certainly there's, in terms of some of the facilities that we're building, we're looking at whether there's ways of jointly resourcing services and looking at how that's managed. Certainly there's a session being set up for the moment for the IJB board members that's being led by the clinical director and involves GPs, so that actually as the board, and obviously there are representatives here on the IJB who can be part of that process to look at what some of the issues are in terms of GP practices and how we can move that forward and embed them further in the integration scheme.
Just back to the issue of delayed discharge briefly. Last week, Tim Davison, Chief Executive of NHS, Lothian, myself and Evelyn were discussing this, and I think that the NHS are very open to this. The challenge for them really is they only make savings when they can close a complete ward. So there's issues, and you all know the kind of the scale of challenges NHS Lothian is facing. That if we can ensure that the community hospital in Midlothian is being used for Midlothian people exclusively, that's not the current position. We can probably get people out of Liberton, and in the meantime, if we can ensure that Midlothian patients in Liberton are brought together in a single ward, then when we get these patients out, then the ward can close, then the money can flow. Now, I think that NHS Lothian are very keen to ensure this model is working, and frankly, in the current time, Midlothian is the only place where there is any chance of achieving that, given the problems with delayed discharge, notably in the city, but also in East Lothian. So they are very keen to get that model working, so there's goodwill there. The challenge is to get a full ward closure, because that's what then releases monies.
Okay, has anybody else got any questions? Alison, sorry, I have a couple. And it's maybe just worth flagging up to members, but we are in a reverse situation where the council report comes last. So if there is any real detail in the council stuff, please get the appropriate officer as they come through, and then wait until we get the council report, and the officers who can answer it are not here. So it's maybe worth flagging up that one of the things I think that we will be flagging up is that in nearly every report, performance on complaints just seems to be a problem through each of the sections. So we'll be looking to see how we're going to improve on that, and maybe be asking the Chief Executive to say a few things on that. Alison, can I just ask you maybe to give us, in your emerging challenges, you can see we're losing £1 million a year for the Change Fund because it comes to an end, and we're also looking at grants to voluntary organisations. Can you give us a better idea, especially with the Change Fund loss? That's a lot of money, and we knew it was coming to an end. What are the areas most likely to come under pressure, and how are you going to sort of deal with them? And is there going to be a need for some of the voluntary organisations to try and pick up some of that slack? So we're watching there's no a double hit coming on any one part of your organisation. Could you give us some indications of what's likely to come under most pressure with this?
The Change Fund's ended, but we have been successful in our bid to the Integrated Care Fund. So under the long-term conditions section, we mention a bid has been prepared and submitted to the Integrated Care Fund. Now, that's actually a greater amount of money than we had within the Change Fund, because we weren't sure of definitely being successful of that, and actually that letter only came in at the very end of last week to confirm that we had been successful within that bid in terms of what we'd put forward as a proposal. We have managed to carry forward the vast majority of the pieces of work within the Change Fund that we felt we needed to sustain. Not everything went forward, but that was in part because it wasn't necessarily meeting outcomes. It hadn't been a successful project. The Change Fund has always been about us trying new things to see what's working in our area, and there'd been a really robust piece of work that had been done to review Change Fund projects, both in the voluntary sector and within both NHS and the Council, to sort of ensure that it was still meeting outcomes. There was a slight shift in the focus between the Change Fund and the Integrated Care Fund. The Change Fund was very clearly for over 65s. The Integrated Care Fund is across the lifespan and is much more about managing long-term conditions, supporting people in their own homes. So it's a wider fund. Interestingly, there was less of a demand within that for us to look at supporting carers. The Change Fund have been really explicit about certain proportions that had to be for carers and things like that. Integrated Care Fund hasn't had the same criteria set to that, but actually just because of the value that we have on carers and some of the voluntary organisations in our areas, we have been able to maintain those services as well. It's been really critical to some of the service development about how they work within our service. So from the Red Cross buddy systems and things like that, we're looking to sustain those services. We hope that the Integrated Care Fund, it depends who you listen to. So we've been given the confirmation of funding for 1 year. There's a suggestion that it might be a 3-year fund, and there's a suggestion that that might be baselined. However, none of that has been confirmed, and at this point in time, we know that we have funding for 1 year. So we're optimistic for it continuing, but at this point in time, we have confirmation of funding for 1 year, which enable us to continue in this work and actually to extend and expand and look at some of the other areas of work, particularly around things like delayed discharge and maintaining people in the community. So at this point, it's not been as significant, but that has literally just been confirmed on Friday.
Okay, that's good news and takes away one of the risks. The next question that I have, and I think it's a question that needs asked, is the statement here: there are currently 2 care homes subject to large-scale investigations. I didn't think we can let that pass without you sort of giving us some detail of that. What is that the right kind of wording that should be in there for that? I mean, that's like Panorama's in town. What are these investigations? Why are they large scale? What's happening with them? And, you know, should we be concerned? Because this constantly comes up that we have different nursing homes that are under large scale investigations. And the reality that there is there are a lot of them. You'll know the one in particular I've wrote to you several times about is, you know, is it no just about time we kicked them out because they're forever under some form of investigation or other. And I'm very aware there's no press here or I wouldn't be talking like this. But can you sort of give members some ideas of what that line is and what kind of actions were taken?
You will be pleased to know that currently the care home you're referring to is not one of the 2 that are listed here. The large-scale investigation is one of the procedures that we have under adult support and protection guidelines. So it's where we think that there is a risk of harm to an individual, and the large-scale investigation protocol is put in place if it's something that someone's doing that may affect more than one individual. So it's often if it's either a care home provider or a care-at-home provider, and because of concerns you might have about one individual, you have to kind of wonder whether that's a concern for everybody that organisation supports. A large-scale investigation will involve, it's a multi-agency meeting that discusses the risks and concerns that are happening. So the Care Inspectorate are involved at that meeting alongside colleagues from NHS and the council. In most care homes, you will have people placed from more than one local authority area. So you would then expect to have local authority representation from across the area. So regularly at these meetings, we'll have people from Scottish Borders, East Lothian and Edinburgh that are also in attendance at these meetings. And at these meetings, we will look at the individual reviews that are happening. We'll look at, obviously, our quality assurance officer, and we have a care home liaison nurse that works within Mid Lothian who does an awful lot of intensive work, particularly if we have concerns in particular care homes. So we'll take report, we'll look at the sorts of risks that are available, we'll be really clear with the expectations that we have of a care home to rectify those, and we'll monitor it. It is around us sharing that risk across all of the agencies that are involved to ensure that we've considered all of the information and that we're taking that information and we're taking decisions collectively about what the approach is. So whether that's for the Care Inspectorate to be going down a route to close a care home, or whether or not the supports that we can put in or NHS can put in to ensure that we can maintain the safety and improve the sustainability of services. The 2 care homes that are currently subject to large-scale investigation are Nazareth and Erin. So Erin's over in Pennycook and Nazareth is in Bonnyrigg, Lasswade area. Both of those, we're seeing significant improvements. The issues have often been down to management capacity, and that comes across as either poor coordination of staff, poor development of staff, not ensuring that care plans have been developed and delivered. Certainly within one of the care homes, they had moved to an electronic system of keeping care plans, which meant that all of the care plans were kept on a computer that was kept in the manager's office. But if I was providing care and support to someone in their room, it didn't actually tell me what I needed to do. Or if there would have been any issues or medication changes. So there were some fundamental issues within the care there. We've got new managers within both of those homes and new management teams, and we are beginning to see improvements. Part of the reason that we keep care homes subject to large-scale investigation for a period of time is that we want to see the sustainability. So we know that managers is an issue, but just getting a new manager isn't the end of that. And it is a supportive process throughout this period. We do have an awful lot of input from our quality assurance officers, the manager who's responsible for that area, and from the care home liaison nurse who will offer advice, support, training to staff to ensure that we're bedding that in. We work very closely with the care inspectorate. We are seeing improving grades, the care inspectorate impressed, but we've kept it closed for a period of time just to ensure sustainability. And we haven't opened to admissions because actually we want to ensure that the care home's able to manage what they're doing at the moment without adding new people who might present new challenges into that mix. Next meetings are on the 27th of March. Unless there's information that one of the other local authorities has that they haven't shared with us, I would expect us to lift the large-scale investigations at that point, but obviously that's a multi-agency decision. But with the information that I'm getting at the moment, we are seeing the improvements we want and would expect to lift those large-scale investigations at that point in time.
Thanks for that, Alison. Has there anybody got any questions on Alison on the specific points that she spoke about? No. Alison, can I just ask one question on it then? There's an awful lot of resource going in there from the council and the care inspectorate. Who picks up the bill for that? Because quite rightly the auditors will come in and compare the cost of running council-run care homes compared to private. Do we recoup the cost that vast amount of support we put in there?
We have done at times. Our care home liaison nurse and quality assurance officers are funded at this point in time. Actually, the care home liaison nurse is funded through Change Fund, what is now Integrated Care Fund monies. We don't recoup the cost of that because actually they will do really positive work. If we had no care homes subject to large-scale investigation, we would still have Angela going in and out and offering support to get the best quality care and best outcomes we possibly can. So it's a post that exists. We have in the past, certainly the care home that you were referring to, that you've had significant concerns. There was a period of time where actually we had managers in there every single day and we did charge them for that. So we fully recouped the cost of that. But actually the quality assurance support and the care home liaison nurse, we don't recoup the cost of at this point in time. We fund them. We see the benefits of that longer term to keep places open and sustain places. But if it's above and beyond that support that we're putting in place, then we have looked with the providers to recoup the costs of that.
You've got to say, it sort of goes round my head here that whenever, whoever they're called now, the worst kids was, the worst we or whatever, when they come in, the first thing they're going to do is sort of say, well, the care home at New Buyers is costing you X amount of pounds in comparison to the private sector, and if we're no firing any balls over, at least on a paper transaction, then that gets disjointed. And neither do I think we should be here to be spending public money for big companies to feel to put management in, and us to have to go in and manage that for them. However, that's really for yourself and the corporate management team, I think, to have a look at it and see whether or no that's something that you should consider. It's another, to me, incentive to stop care homes falling below that standard, where if they think they're going to have to pay the bill for us coming in, then they might ensure that that's there. Brian, I see you. Have you got a question on this issue?
On this issue?
If it's not on this issue, I'll catch you in a minute then. Yeah. Alison.
What I would say is that the care home liaison nurse and the quality assurance also work within our own care homes. So actually in terms of the learning and development and best practice that's put in place in terms of the training, Angela also goes into New Buyers and Highbank, and our quality assurance officers will also do internal audits of our existing services. So it's not that our internal services don't get the benefit of those staff as well, but hopefully they're not needed with the same level of intensity that at the moment the large-scale investigation care homes are, but we do use them across our own care homes as well, and it's about getting a really good quality, consistent service. And I think we see it as preventative and meeting some of the targets. So actually delayed discharge relies on us having good quality care homes in our areas and care homes that are open, and it's in our best interests to invest something within that in the long term.
I fully agree, but it's just the transparency fact for me to make sure that when they're measuring stuff against the council, it's being measured fairly with the private sector. Alison, the other areas, sorry, I'll just touch on them. And the implement improvement plans, I see we've got 3 off target, and the 3 that I would have had hoped would have been on target. We're talking about invoice and functionality and framework I that are off target. Are you confident that you will have them in up to stage for May and June?
There's been significant work that's been going on. In part, we're currently doing some work with CallLogic, which is the provider of Framework I, as we're due an upgrade onto Framework I, and that will improve the functionality. Also, as part of the management review, Framework I is no longer managed by adult social care, but is managed as part of a systems review. So we've been undergoing a staffing review to ensure that we've got the right supports in place for that. But yes, I'm confident that in terms of some of the back office work, that has been progressed. But there are a number of factors as we move forward with Framework I, experiencing some difficulties with getting the upgrade within the timeframes that we would want to have that upgrade put in place. So that is presenting some challenges for us at the moment. But in terms of the functionality for the invoicing, we should be able to get that bit in place, but there are some challenges, as I say.
Thank you. The last question I have is on page 17 at the bottom of page 11, which is regarding the number of carers who feel valued and supported to continue their role. It's a very low percentage, it's 46%. I can see what you're saying, it was taken over the sort of Christmas period, and maybe that's had an effect on it, but I see it sort of stayed 46% across the board. I would have had hoped that sort of feedback would have been a lot higher than that. Do you think that accurately reflects what people think, or do you just think it's people no answering that question, and is it worth maybe digging down into what we could do about that?
We've historically had fairly low numbers of carers that respond to surveys. And in part, I suppose it's difficult to know whether the people who are responding because they've had particular issues and they want to raise that. But that doesn't mean to say that we don't have to address those kind of issues. We currently, the results are just about in for the new carers survey. We're just beginning to analyse some of that information. And a lot of the comments are really positive, but if you've had a bad experience, I think you're more likely to take an opportunity to complete the survey. We tried a different approach this time. This isn't going to be the news that you're looking for. We tried a different approach this time, and we also put the carers survey on a survey monkey and linked it to the website, which actually means for this year's survey we've had an increased number of people who've accessed that, but we've seen a reduction in our results because of that. Now, at one level, I have to say I was extremely disappointed when I got the results and was really negative about it, but actually it just evidences that we need to be getting out there more, we need to be doing more to get to those carers. We don't know an awful lot of the carers that are actually out there, and potentially we've managed to tap into a group of carers that historically we've not been able to tap into. Carers need to identify themselves and often are reluctant to do so for a variety of reasons, and whatever that may be, and it is really difficult. There's an awful lot of work that goes on in Midlothian, but we've obviously not quite got that right as yet, and there's far more work that we can do. We've got fantastic working relationships with Vocal. There's a new carers bill that's coming out that's taking some of those responsibilities one step further, and I think it's a good opportunity for us to work on that, but they are disappointing results is all I can say, and there's much more that we can do to support people. There's been an awful lot of work going on with staff around changing the way we do assessments, and it's been much more about a conversation with people and about evidencing some of the support and the value that we place on carers, but that's an ongoing process, and we would hope to see some changes within that at this point in time. But there's a lot more work that we need to do. Really active carers groups, locally, really active carers strategy, and obviously representation on the IJB and on the strategic planning group, so we'll hope to see some shifts within that, but you're right, it is a disappointing figure.
Did anybody else have questions? Brian first, then Kenny.
You've touched on both the subjects I was going to speak on, but the young carers, there's been a lot of developments in young carers, where their identity kind of card kind of system and stuff like this. But I'm more interested to know is why do the carers feel undervalued? And obviously an update on this, and you can take this offline if you want for a bit more experience, but if it's just a tick box kind of answer, and they've not got a chance to input is why do they actually feel undervalued? I'd like to know more about the actual survey criteria and how it was done. And the number of adults satisfied with social work services has been 42%. I'm completely dismayed at that. And I think that's so worryingly low. And again, I'd like to know, and you can take this offline for expediency as well, I'd like to know the criteria, the kind of questions that was asked in that kind of survey, and did they have a chance to input again into the reasons why you know, they felt dissatisfied, and that would be, and I'll take that out online along with other offline as well, if you want, Chair, with more information on the Caledonian project and the number of men involved, etc., etc.
I mean, I'm happy to share the more detailed break. I mean, obviously those are key points within the survey and doesn't break down all of that. So I'm happy to share the more detailed survey results if that would put more of that into context, and then can pick that up with you in more detail if there's questions that come out of that, if that would be helpful.
Thanks. Mine's just a little bit more straightforward. Just back on the carers who feel valued, the 46% kind of excludes people who neither agree nor disagree. Now, if that's quite a big area, it could suggest that the number of people who actively feel not valued could be quite low. Could you share with us the number of people who did neither agree nor disagree, because that could make quite a big difference to the reading of that figure?
Certainly I can share that. I don't have that level of detail with me, but I'm happy to share that as part of the overall survey information with you.
Okay, I think we'll wrap this up. Alison, could firstly thank you very much and congratulations. You have answered for nearly an hour now. Detailed questions, and apart from the last one, I think you managed to give full answers. So genuinely congratulations and thank you very much for a very able session. Can we now move on to item 5A2 as Customer and Housing Services? Kevin, have that to follow.
We've had our moments, I think, Chair, in the Chamber. In terms of Q3 for Customer Housing and Services, in terms of libraries, they've continued their range of local-based activities. Members will be familiar with those, given the predominance of surgeries, I'm aware, are held in the local libraries. There was the commemoration event in terms of First World War casualties, which was carried out on the 22nd of November, which was very successful and well received. We've had the Welfare Reform Resilience Fund project established at Corbridge Library. This is to assist people in terms of online claiming and also online security, as that will become more prevalent as universal credit rolls out. Interestingly, in terms of previous questions we've had in the Chamber relative to channel shift, we've noted the reduction of around 35% in physical contacts at the libraries, but this is offset by the e-services, which have similarly risen by that element. So there is channel shift ongoing, and more of that relates in terms of the customer service review, so that we're looking to respond to customer expectations and indeed customer satisfaction through more efficient use and reduction of transaction costs across services. And we're moving on in terms of finishing the housing service review structure. We're now formally moving into a look at the structure and operations of customer services across the contact centre, libraries and registrars are due to join us in the new financial year. Relative to homelessness, there's been a reduction, so we're looking at that as being a success in terms of reflecting the prevention activities. Whilst the numbers are not in the detail provided to members, from 12-13 we had just short of 750 presentations of homelessness. In 13-14 there was 604, and the year-to-date yesterday was 533. So it certainly indicates the value in the prevention work that is ongoing. And whilst those presentations are decreasing, as we're noting, the budget value is still over £1 million in the provision of bed and breakfast spaces. And we've had an additional requirement, which was originally budgeted for, but we've had further requirement over and above that, as reported in the variation in their financial reporting to Council. Equally, in terms of the reuse of Pentland House and Midfield House, we're looking to make arrangements to offset that and avoid that spend in the years to come. In terms of challenges, there's the ongoing situation at New Byres Crescent, which members are familiar with, and we're continuing to carry out the activities for rehousing through the range of housing options. As at the end of last week, we were down to 15 households. There are 2 being moved this week and 2 scheduled already for next week. So we're continuing to reduce the occupancy of New Byres, where we will ultimately demolish and rebuild following Council decision. In respect of revenues, there's continuing pressures there. We do have increased recoveries in terms of council tax. Our income stream is up 0.5 from where we were at this point last year. In terms of rent revenues, it's a poorer picture, but it remains under 10%. And in terms of a snapshot with our other local authority peer group, we're doing relatively well. And of course, the year end will be reported in due course. Welfare reform, we've looked back in terms of the effects at 2014, and that was reported to Cabinet last week, and we will be submitting a further report to Council relative to universal credit, which rolls out and takes effect in Midlothian on the 27th of April. And in community safety, again, I appreciate that this has been a recent issue for members in terms of new psychoactive substances. There is work ongoing in terms of the analysis and the service provision across ourselves and third sector partners and NHS in terms of profiling and responding to the demands that that's continuing to make to us and partners, and looking to the learning for other local authorities, and we look at with interest to developments which are happening down south in terms of available legislation. Relative to performance targets and variances, appreciate the concerns expressed this morning in terms of complaints. Whilst that is applied across all services, certainly there is an analysis of complaints, picking up an earlier point, to develop that beyond just the recording of complaints, but into customer satisfaction. So it's taken the learning that has occurred within housing services, where we do our annual survey of tenants, but also to incorporate that across all of customer and housing services, and ultimately to other services across the organisation in the coming year. So we provide that analysis on a monthly basis, and we've been doing work through planning and performance with Ian and his staff in terms of how we roll that out from just being a task that sits in the contact centre. Thank you.
Thanks, Kevin, even with this here throat in the cold. Questions? Margot.
Thank you, Chair. I have a couple of questions, if that's okay. With regards to the homelessness, you've got bed and breakfasts listed there. Can I ask how long is a stay in a bed and breakfast for a young person? And could you maybe give us the Pentland House and Midfield House when those may be ready for occupancy? And on the other one, obviously to do with the legal highs, as I call it, I see a fair bit of work there, and I congratulate the staff and the amount of work they're doing, and obviously congratulate the Council for taking forward a cross-party motion on it to the Westminster Government. But can I ask what is actually done with the information? I mean, it's a huge worry that a lot of these things are actually contaminated, which leads to more deaths and obviously admissions to hospital. So I just wondered if you could give me a wee bit brief on what they do with the work. Is it just put in a report, or is there anything further constructive done with it?
Certainly. In terms of the bed and breakfast provision, the temporary accommodation in a whole, we look at that as a minimum of 3 months. And the reason that we're looking at 3 months is to counter the provisions within Welfare Reform Act. Whereas if people who receive support or are accommodated out with council hostel arrangements are then subject to the full effects of welfare reform. Whereas if they've been accommodated for a minimum of 3 months within an HMO that's licensed or operated by us, or a hostel, then they are excluded from the single shared room rate for those who are aged under 25. So we're trying to be a bit clever about that. So the whole purpose of ensuring people stay with us for 3 months is to benefit them when they move on from that property. They then can get eligible rent charge for a one-bedroom property rather than a shared property if they don't go through that process. So the minimum is 3 months. The longer period, as you were referencing, has averaged about a year. Yes, has been about a year, and we've been actually looking at those cases in the past 2 weeks to see where we can convert people into continuing to live in the accommodation permanently if it's appropriate to them. Some of it, the temporary accommodation, some of the temporary flats that we use. But in terms of B&B, the longest we've had has been up to a year. In terms of Pentland and Midfield, the work is ongoing there. Whilst we've had governance around the reuse of those projects, and of course we've carried out community consultation in regard to those, we still have to go through the due planning process, and a planning application has to go in for change of use, and also a building warrant, because we're looking to change reconfigure some of the property. Not extensive works, but it needs to do that to ensure the safeguarding and security of the change of use to the client group that we'll be making use of. And to answer your question, I would anticipate around about August time that we would be able to make use of those properties. Relative to NPS, yes, whilst they may be considered to be legal, they're certainly not considered to be safe, and that is the public health message which is going out. They may be legal, but they're not safe. We have no idea what is in some of these substances and the composition of them. So certainly health messages is what we're focusing on at the present time. But as I say, we're looking where there are other activities across the whole of the UK. I mean, most recently, in the past week or so, Lincoln Council were looking to see other ways that they could make this illegal within the powers that are available to a local authority. So we're all watching that with interest. So we're trying to learn from each other, because currently, as is by its definition, these substances are legal, and we have to look at other ways of addressing that. And we're doing that through MELDAC, clearly, NHS, police and ourselves, and the impact that it's having across social work and education and others as well. So it's a collective response, but I wouldn't pretend we've got the answer as yet, but it's a work in progress.
Kenny.
Thanks, Kevin. Just to follow up on that, it's quite alarming, I suppose, for me to read just the issue about contamination in the report. Could you just speak a little bit more on that? I mean, obviously, we do not know the composition of these new psychoactive substances, and many of the items held within are toxic. But when you say contamination, what does that mean? I mean, is there a suspicion that it is being manufactured with known toxins, or is this just an issue of the very nature of what these substances are? I had just never heard there being a contamination issue before, so I'd be interested to hear.
Certainly, we've had work done through the partnership analyst, who's a role that's funded by the council and the police, and certainly the work that's been scoped and collated there indicates that whilst there are illegal substances to some extent in the composition of some of these, that can vary. And given the press are not here, I would say that certainly some of the police view is we'd rather know that we're dealing with illegal substances than some of these so-called legal substances, because we know how to deal with those, we know how to respond, and so do the health services. With these things, we don't know what they are before we're able to react and respond and give appropriate care to those individuals. And that there's a whole range of symptoms that have not been evident in previous treatment and support in terms of how that's affecting the individual, let alone if there's a mix of other issues like actual illegal substances or alcohol, which are brought into the mix with the individual as well. And we've certainly had direct experience of that in people who present to our services across the whole campus. In recent weeks, that has been a regular experience for staff at the front end. But in terms of what's actually within them, I don't have that analysis. I'm not sure that we can actually share that with you with what I've seen to date, because it's been at a restricted level with the police and the NHS. But it will be certainly something we will be able to come back and report on in the subsequent quarter in the next few weeks, how that's developed.
Any other questions, Jim?
Just a couple. On page 26 in your narrative on the challenges, about the revenues collection performance has been reviewed, and there's an awareness that these results need to improve. Could you just expand on that a wee bit? I mean, just reading that like that suggests that issues have been uncovered in terms of, things not being done correctly. Is that the case, or is it just looking at the overall figures when obviously we're looking to improve them? Or is it specific issues in there? On page 30, in libraries, the second last item on that page talks about work experience opportunities. We've missed the targets on that, and given that positive destinations are really important, What's the story behind that? Why have we not achieved the target on that one to give people experience in libraries as a positive destination? And the last question is on page 37, and it's around the antisocial behaviour contracts. There's been an increase in the number that have been breached. 9 people breaching them, 36%, where our target is 18, so there's twice as many breaching them. I've always found these kind of things a bit woolly, but they actually seem to work, because we've sitting somebody down and talking to them about their behaviour, surprisingly to me, has actually resulted in changes, but there does seem to be a drift in the previous month as well for more being broken. Are we getting to a point where folk are wising up to these things and they're starting to, pay lip service to them rather than actually take them on board, as seems to have been the case in the past?
Okay. In terms of the revenues position, no, there was nothing fundamentally wrong or bad, if I use that term, in terms of the service itself. It was certainly, there is that awareness that we needed to do better, frankly, because we were 30th out of 32, and that just wasn't good enough. So we had to improve our collection rate. We certainly have one of the highest direct debit arrangements across the local authorities. We're at 72%, and that bears very good comparison with our peers. And certainly, as I was saying in the narrative, in terms of the snapshot position at January for council tax, out of 29 authorities who responded to the Institute of Ratings and Valuers, there were 14 authorities who had improved their collection position, and we're in that category. There are 11 who have deteriorated, and there are 4 who've stayed the same. So we know we've got better, and we'll have evidence at the year end how much better that is in terms of which quartile we sit in, but it's going to be better than we are now. So certainly, as again yesterday, we were 0.5% up on where we were at this point last year. So we've got better, and we need to continue to do that work, absolutely, for revenues. In terms of the work experience opportunities in libraries, what we've done is we've rephrased that for the coming year to work placements, because it's not looking at people who particularly want to work, it's also looking, as you've indicated, people who are looking for a positive destination or a placement, and we have a number of those, and we accommodate everybody who has a request for that in the libraries. So we're redefining that to reflect the reality, the actuality of the provision that we make there for people. So it's not just about work experience. People will be coming in for all sorts of arrangements, like the book bug, like PEEP, like numeracy and literacy, and a range of other services who also engage with us. So we're going to make that reflect more of the reality of what goes on in the libraries rather than just a work placement, doing a job of a librarian or a library assistant, because it's better than is evidenced in the results here. And in terms of ABCs, certainly the spread of those is beyond our own housing stock. We operate on a monthly basis with the Antisocial Behaviour and Violent Offender Group, which is ourselves, again a range of agencies, police and local housing associations. So given that antisocial behaviour isn't tenure specific, as I appreciate you'll be well aware, it's also offering those opportunities, those tools, those mechanisms to our counterparts in other housing organisations as well. So we've got a greater spread of those. So I wouldn't say that they're less effective, but we've got more targeted interventions there. And as you've indicated, some people just aren't aware of the impact that they may be having on their neighbours, and a sit down with our officers certainly makes them aware of that. Some that has no impression on at all, and that escalates through to either an ASBO or an eviction if we're taking a tenancy action. And the purpose of that coordinating group is we sometimes do both the antisocial behaviour action and the tenancy action, because we can do that in terms of our own tenancy management, and it's encouraged that same practice with others that we've brought them into that forum as well. But equally, it's indicating that there are 9 people there. What we used to do was measure just the actual ABC or ASBO, if that had been breached once or 9 times, it was just counted the once, whereas we're now being a bit more refined about how we report that. If that person, as is indicated here, there are 9 people who have breached more than one time, then that's being reported to give a better reflection of the actual activity that the team are responding to. So there's not as many ABCs as we've had in the past, and indeed there's not as many as ASBOs as we've had in the past, but they're better managed and more collectively managed. It's not just the council, it's also the police, it's also social work, because sometimes it's an intervention rather than a sanction that we need to apply in certain cases.
Thanks, John. Ian.
Thank you, Chair. On page 33, the item at the top, 19.1, it refers to the action being to minimise relet timescale for mainstream housing and temporary accommodation through voids and initiative actions. I'm aware of what voids are. Could you maybe explain what initiative actions are? And also under the comments, it says the requirement to prioritise and relet new buyers Avenue and Gore Bridge tenants affected by the CO2 emissions has adversely impacted on relet timescales. I'm a bit confused as to how that would affect the relet timescales, unless it's maybe my understanding. Thanks.
No, certainly. And this has counted voids as a whole, both the temporary properties and the mainstream properties, as is evidenced there. But behind that, actually, we've got a better performance on our temporary properties. They're turning around within about 31 days, and that's under the Scottish average. So we've got a better performance there, because indeed that's what I requested of our property maintenance colleagues, is that if we have to push, that's the area we need to push, because it gets people out of bed and breakfast and to move on into those properties. So indeed they have been delivering on that. The mainstream ones, they are impacted by new buyers, and the reasoning behind that is we have aimed to accommodate all the needs as well as preferences of the households that have had to be relocated from New Buyers Avenue and Gore Avenue. And the choice element has caused us to hold some houses and do additional work to some houses than would otherwise have been standard, and that all results in additional void cost, ultimately, which is what we're reporting here. So there's longer relet times, but it's in order that we meet, again, customer expectations and satisfaction, which predominantly we've done to date, but it has had that result, I'm afraid.
Margot.
Thanks, Chair, for letting me back in again. It's actually page 31, and it's regarding I've never heard of this before, actually, the recovery conversation cafes and libraries. Could you give me a wee bit more information on that, and as to why the peer support worker is not being recruited yet?
Yes, we had one of those events, and it did prove successful, and we aim to replicate that again this year. There have been difficulties in recruitment, but that was relative to the funding, because it was external funding that was dependent on, rather than something that's in the council's establishment itself. So that's led to the delay. We've, in fact, waiting on confirmation yesterday, because the new customer services manager was meeting the Scottish Library and Information something, sorry if it escapes me, who were providing that funding, and we will find out as a consequence of that whether we will get funding to run further recovery cafes. But certainly it's something I can assure my director is keen that we replicate again, because it did have measured successful outcomes from the last effort that we did there. And this was in terms of both alcohol and substance misuse clients previously who benefited from that event.
Thanks, Kevin. Any other questions for Kevin? Kevin, I have only one for you, and again, it's regarding the implemented improvement plans. Obviously, these are either internal or external audit improvement plans, so therefore a critical or best value review. We seem to be talking about the number of on-target completed actions 13, the number of outstanding actions 16. In the notes it says actions detailed and specific measured outcomes listed. I'm not actually sure what that means. What is the crux to this area? Because we seem to be off target with some major stuff. As I say, these are normally internal audit or external audit requiring improvements. However, there are so many that are still outstanding, and how many of them are actually off target and on target?
Certainly, excuse me, accept, Chair, that you don't have that breakdown reported here, but I do have that through our local performance monitoring that I was doing with the managers yesterday. So I can provide that to you for sure, because it does exist within the service. Predominantly, as I recall, most of those were in relation to systems, and I know you've heard that already this morning, but this is externally contracted systems, and those providers were looking at a workaround for us. Again, that's in the narrative of the separate covalent report on audit actions. The other improvement plan that we have is following on the Audit Scotland assessment, which was fairly successful, but came up with 9 new recommendations to replace the previous 21, and indeed Audit Scotland have sight of that, and we have our own external auditors coming in next week just to give us validation about the progress that's going on in that improvement plan. So I can provide both of those to you separate to the meeting here.
Okay. I think it's important that when there are improvement plans, and especially if they've been asked for from internal or external audit, I think the details of them should really be in the report so members are aware of them.
Sorry, just an addition, Chair. It was the intent, because we brought those to Audit Committee and PRS when they first came out, and each quarter we intended to return with the update and progress plan of each of those. But I appreciate they're not in the quarterlies as you would expect to see them.
Yes. Okay, any other questions for Kevin? Okay, Kevin, thank you very much. We now move on to Item 5B, Education, Communities, Children's Services. Joan.
Good morning, Chair. The high-level strategic outcomes in relation to children's services. The vast majority, or a high percentage of our work, continues to be driven by the Children and Young People Scotland Act 2014. In particular, the 1st of April 2015, we have a duty under this new piece of legislation to look after young people who are accommodated up until the age of 21 and offer advice and guidance up until the age of 25. So this will have an impact upon our service. The named person, and I'll touch on that later in relation to the ongoing extensive work that's happening in relation to that with education and health. Public Protection Committee, I've been told by a reliable source that police will move in next month, in which case Children's Services staff will also take part in moving down there in relation to undertaking child protection referrals, and also looking at certain reviews in relation to child protection, IRD reviews, which we carry out on a fortnightly basis. So they'll all be taking place from Musselburgh, so it's becoming well established. The Family Resilience Project has had an independent evaluation, and I think it's fair to say that obviously there's a lot of good work that's happened here, and what we need to take forward is that this is an approach and how we're going to continue to work in the future. We're looking at extending this for another year, and then we need to look collectively with other agencies both within the Council and externally as to how we're going to take this approach forward, because I think we've shown beyond recognition that this is a good way of working. And in fact, I was advised yesterday that 5 of the young people who had been on supervision orders were actually removed from the supervision orders because of the good work, which is a huge piece of work that's been undertaken and good outcomes for this family. The residential review is still underway, and we're almost at the point where we can go to consultation with staff. Obviously, we still to consult with staff, but it's fair to say that we will be ensuring that staff are well equipped to undertake the job that they're hired to do. We have a lot of high-level young people who are now accommodating our residential units because we have this ethos that where possible we maintain children within Midlothian, and therefore we need to equip the staff both with the skills but also the staffing levels that will continue to support them in this way forward. So I'm hoping that by the next quarter we shall be able to report on that and give you some more detail in relation to that. Self-directed support, as Alison touched on, also impacts on children's services, and this is about, another new approach in working in relation to giving families choices, and there's been a huge amount of work undertaken in family support. So the next area of development will be in relation to social work, which is obviously taking it to another level. But again, it's about engaging families and asking them, what works, because often, as we know, families have better answers than what we do as practitioners. The integration of children's services with adult and social care. We have an event at the end of this month with practitioners in relation to looking at Sophie's pathway, and it's getting it right for Sophie. And again, that's about children's services and NHS coming together to make sure that we have a linear process to making sure that Sophie gets access to the appropriate services at the right time and at the earliest opportunity. Our child protection figures, I'm glad to report, are below the national average at this moment in time, and that's as a result of a lot of hard work that's happened in relation to, and a lot of training as well in relation to practitioners with police and our health colleagues coming together and making sure that we only register children where there is significant harm. This appears to be working, and we have a very robust system in which we are checking and double checking to make sure that these kids are the right kids that are placed on the register. But I suppose what I need to highlight is that there's still a lot of work that's happening below this level that ensures that people don't reach crisis and reach the child protection level. So this is a lot of good work that's happening, and I think we're now seeing the impact of this at this moment in time. In relation to challenges, unplanned overspend remains one of the biggest challenges within children's services. We can't predict when a family or a child is going to go into crisis, and obviously the one principle that we all work under is that children need to remain safe. So if we need an external resource, then we need to purchase that. At the tail end of last year, we had 5 young people in secure. We're now down to 2, and I would expect 1, 2 to be sitting at the average. And in comparison with other local authorities who have consulted with us, is around the right amount of number that, or around an average number that we have in secure at this moment in time. The implementation of the named person, this is a challenge because it's a huge piece of work. The guidance is out for consultation at the moment, which we're going to be feeding into, but there are a lot of questions still to be answered in relation to what happens during holiday times, during school holiday time, because as we know it's the head teacher that's the named person from 5 up to 18. For all those young people who are between 16 and 18 and are not in education, who then becomes a named person. And also we have an issue at the moment in relation to health, where there's nationally there's a shortage of health visitors, in which case August 2016, how are health going to accommodate that? And I would hasten to add that we are in consultation with health, and we're looking at creative solutions as to how we can try and resolve that, because it's everybody's job, obviously, to make sure that children are safe. But this does remain a challenge, and there's a huge amount of work that's been undertaken. And the final challenge is sickness absence, which members will see we are off target. And again, we have support from our HR colleagues, where they're coming out to do training with all managers, and myself included, and my service managers, to make sure that we're on top of this and that everybody's being treated fairly and consistently across the local authority. Any questions?
Thanks, Joan. Questions, comments? Jim?
On page 11, or the reports at the back of your original your narrative, there are actually page 10 and 11, a few items where to do with young people being looked after away from home, etc. The indicator needs to be reviewed to change more appropriate and relevant wording. Why is there no still the reporting on the basis of what was there before? Even though it's going to change, we're not getting any figures on that, even though we accept it's maybe no right and we're looking to change it. Why are there no figures in there? The other point, I suppose, is page 43, your challenges. You're talking about the child protection figures reducing considerably, and I understand, there's that balance that you've got to strike between, playing it safe and no putting people into situations where they didn't really need to be. But then you're saying it's offset with increased risk-taking behaviour by young people in the communities. I presume there's no any links to that in terms of anybody falling through the cracks, in terms of no being protected. But these things are not linked. I'm just looking for some kind of... It's just them both being in the same sentence there. A wee bit of explanation on that, if you could.
Start with the latter one first. In relation to child protection, the child protection register is one way of identifying children who are at risk, but there are numerous children who are at risk that remain within society, that remain living within families, and that didn't necessarily need to be put on a register. I mean, the risks within the community tend to be, and we've already touched on it, NPS is one of the risks, although I would hasten to add on the back of that, drugs as a whole and alcohol still remain, you know, other concerns. NPS is a tiny percentage of that. Valiums and all the rest of it are still being sold out there, as they always have been, as is heroin, and alcohol remains our biggest concern, to be quite honest. So I suppose it's about the management of that, and I think where we have become more robust is that we are no risk averse, but our job is to manage risk. We'll never ever get rid of risk, and especially in relation to older teenagers, we need a robust plan, and that isn't always a child protection register. And in relation to managing that, we work really closely with health and with police, and with our colleagues in residential as well, who are equipped with a lot of skills in relation to managing risk with older young people, and we believe that that's a much better way to manage them and get better outcomes for them. Sometimes it tips, and that's why we had that escalation into secure. But again, that's a collective decision. It's not a decision just by children's services. It's collectively, and it's also coming from the community as well, and parents. So, yeah, I suppose my plea is to get away from just thinking that child protection is the only, everybody that's on a register, they're the only children at risk. There aren't. There are other children at risk, you know, but we have to manage that risk as best we can. And I think we're doing a much better job at that, because we're doing it collectively with other agencies, and we're getting that support. In relation to your other one, about the measuring, I'll be honest, I'll have to come back to you. I don't know why I've not got other data on that. I do know what our intention was in going forward, is in that we need to get better at measuring where young people are in relation to their academic ability when they come out of residential schools. Because what we've found in the past is that young people come out of residential schools and don't have the reading and writing levels that we would expect them to have. And we're working with educational psychologists now with the standard 5s, I think that's what you call it, in relation to measuring people when they enter there and then coming back out again. It's still a very crude way in relation to measuring people, because by the sheer nature that you're in a residential school suggests that there are a lot of other issues happening. So education per se, as in getting qualifications, might not be the highest thing on their agenda, but I suppose we do need some baseline measurement in relation to making sure that we're getting good value for money and to making sure that everybody's doing their job. But can I come back to you in relation to why I've not got previous data, because I don't know the answer to that.
Thanks, John. Any other questions for John? Margot?
Thank you. I'm interested in, obviously, Dalkeith House. It says it's managed to support 45 young children to remain at home. Does any of these 45 children were actually staying in Dalkeith House for any period of time, or were they getting support from the staff in Dalkeith House? And can you confirm that it's not being used as a supervised contact centre anymore?
Right, my understanding is it is still being used as a supervised contact centre. Yeah, and I can say at this moment in time, nobody resides there at this moment in time. Obviously, the residential services is under review, so we'll need to see where that takes us in the future. We have had one family staying there. Mum lives down in England, and in the south of England, and she's been rehabilitated back with her family. And in order to do that, rather than going to a hotel, which is a false environment, most of us don't live in hotels, we have allowed her and our new partner to come up and stay overnight, and then staff go in there in the morning and bring her child to her, and then obviously sometimes the supervisor, I believe it's now going to unsupervised contact. So that's the only person that I'm aware of that stayed overnight. But yeah, in relation to supervised contact, yeah, that's still happening in there.
Okay, any other questions? Alison, I only have one question on page 54 of the committee report, and it's maybe just a comment on the child protection. The initial cases held within 21 days. You can see there are two off from the 9 because of sickness absence. I think it's really important that we continue to push to make sure that all these cases are held within the 21 days, because if something goes wrong with these things, that's usually what the press jump on. But the question I really had was on the next one, which effectively is protecting Midlothian's children's child protection and review case conferences held within 3 months. One of the reasons for the target being off, you give us that there were 16 reviews, 13 were on target, one was an RSPCC postponement as parents were unable to attend, I'm not sure why we would postpone something because the parents were unable to attend. In my view, the children's safety should come first. But the second one is the estimated due date of delivery for newborns. The kids arrived early and the date's no changed. Is there no something we can do to make that flexible? Because that's not something that would lie comfortable. Well, we've not had the review because the bairn arrived early and nobody bothered changing the date. So could you maybe give us a wee bit on that, please?
Yep. In relation to non-parental attendance, I would argue that it's very, very important for parents to be there, especially if the children are going to be deregistered, in which case they're living at home. I mean, the vast majority, almost 100% of children who are on the register should be living at home. That's where the significant risk is, but that's what we're trying to manage. So parental attendance, and it could be because they've got a job interview, they're felt unwell or something like that. One of our main priorities is engagement with families, and so we would see that as a must in relation to parents attending. And also, it gets better outcomes for the children as well. And as long as we're aware of it, if they're on a register anyway, there will be ongoing multi-agency meetings and things like that, so another date would get made relatively quickly. In relation to estimated delivery dates, we have to go by what the midwife tells us. And unfortunately, our computer systems at this moment in time don't allow us to change it. We need to do it away in advance in order to get a review date, and then we can't go back and change it for some reason. So we need to look at that for the future. But again, as soon as a child is born, a child will not be discharged from hospital that's on a register before a discharge meeting is held. So there's nothing getting missed here. I can reassure members for that.
Okay. Thanks for that reassurance, John. Thank you. Any other questions? None. Joan, thank you very much. Okay, we're now on to item 5B2, Communities and Economy. I take it, Ian, that's you.
Thank you, Chair. The emphasis remains very much on driving forward and promoting economic development. That's not to say that's at the expense of any other part of the service, but I think that promoting economic development has the opportunity to feed through into so many other areas of the service in terms of supporting communities and community groups who need the greatest amount of support from the local authority. Just two areas to pick out in particular on economic development. One is the city deal, which was reported first to Council back in December. And this is essentially a consortium of the 6 local authorities in South East Scotland putting forward a bid for city deals status to Scottish and UK governments. And the first stage submission for that is due in the next few weeks, probably by the end of the month. And it's expected that a further report will come to Council on the 24th of March to update all members on that. And that's a pretty significant bid. The Glasgow City deal is releasing £1.3 billion over a 20-year period for a number of major projects throughout the Glasgow area, and therefore the expectation would be that in the event of a successful City deal bid from Edinburgh and its wider area, that we would see benefits accruing across the region. The second key area for this year is the Borders rail line opening, and there's been a lot of activity in relation to that. There's been the blueprint document, which has been widely publicised. There are a number of work streams that Borders Council, together with this council and other stakeholders, are involved with. The opportunities are substantial, and the significance is to try and ensure that we do take advantage of those opportunities, particularly at this time. There are funding opportunities from Scottish Government which need to be taken advantage of, and the opportunities for key sectors of employment and activity, particularly tourism, are very strong. That tends to link in with other elements of the service which the Communities and Economy has. So in other words, new employment and housing development coming forward through local planning. And that's been happening for a number of years in terms of the allocation of sites, particularly around Gorebridge area, for example.
and also town centre improvements. And currently there's the Conservation Area Regeneration Scheme at Gore Bridge, and we'd like to see potentially taking some advantage of funding opportunities through the Borders Rail line to enhance what's already been done there. It's not just about jobs and access to jobs and training, which certainly the Borders Rail line will do, but also about housing opportunities, and that's especially affordable housing, where in those localities that the train will pass through, there is a substantial demand for that type of tenure. And it's also about improved quality of environment as well. If we look at the planning for all of that and the remainder of Midlothian, then in terms of the local development plan, the proposed plan, which Council has given its approval to, will be formally published on the 14th of May for a period of 6 weeks for the receipt of any objections and other representations. That 6 weeks keeps us within the school year, so we will not be bleeding over into the school holidays, so we can actually cover that period effectively. There will be advanced, or there is already advanced notifications going to community councils about that, because sometimes their meeting schedules are such that they would like advance notice of what's happening. So we've done that. Just in relation to town centres, because I touched on what's happening at Gore Bridge, at Pennycook we are hopeful that there will be a positive outcome to the ballot in relation to the proposals for a business improvement district in the centre of Pennycook, and that ballot takes place towards the end of May. We would see that, if approved, as an opportunity for improvements to come forward, and also to link in potentially with a bid, should we be able to make one, for Townscape Heritage Initiative or Conservation Area Regeneration Scheme for Pennycook Town Centre. Now, currently there is no offer from Scottish Government. There's no current round for that, but we expect there to be a further round, and that's an opportunity that could be taken. In relation to frontline services, because so many of the frontline services are within communities and economy in relation to the regulatory side, with the appointment of a single planning manager to cover the whole of the planning service, down from 2 to 1 managers in relation to that, we're taking the opportunity to review the planning service. And one of the advantages of that, one of the opportunities, is to try and address the deficiencies, which I think everyone accepts, in relation to the provision of biodiversity and addressing climate change. So that's one of the factors which we're looking to see as part of the service review. Glad to see, and just a quick mention, that Building Standards Service externally reviewed and still retained its Customer Excellence Award, which is pretty good. They also have Investors in People status as well, and I'd like to think of that service as an exemplar in many ways. The results of the pilot partnership with East Lothian Council in relation to environmental health and trading standards, the results of that are now being considered by the chief executives and directors of the two councils with a view to come to a conclusion on that. And we're certainly looking to complete work on bringing together on the formation of and rolling out of the new communities team and the planning and performance teams which were established under the new Service of Communities and Economy. That's not to say that there hasn't been steady work being done, but a couple of the off-target items which you'll see in the papers here are essentially a product of the fact that we've been getting ourselves up and running. What I would say is I don't think there's been a substantial impact negative on communities, but certainly we're looking to move that forward quickly. And the Council's review of services to communities, which is being undertaken, ties in very closely with that. I think, Chair, that's all I wanted to say by way of an overview of everything. Obviously, the papers are there in front of you, and more than happy to pick up on matters of strategy or detail.
Thanks, Ian. Questions or comments? Ian.
Thanks, Chair. There's a reference to, page 65 on CES 13.5, the radon gas issue. And I remember this, there was quite a bit of publicity when this started off, the testing for it. And I understand Midlothian was at a slightly higher risk because of the old mine workings that the radon gas can come up through. I'm just wondering if there's any progress on that. But also, there's been talk as well about the possibility of using the old mine workings for geothermal energy, which is something I know some of my colleagues are quite keen on pursuing. I'm just wondering if we did do that, whether there would be a risk of, in some way, increasing the amount of radon gas and also carbon dioxide, which we've seen also, which looks like it may have come from the mine workings, being increased as a result of that, and whether this work to monitor it might help us inform ourselves of that situation ahead of going ahead with any of that kind of work.
Certainly in the case of the slowdown in activity in relation to monitoring the radon side, essentially it's because of another factor which came in last year, which was the new buyers, which our environmental health team were heavily involved with. In relation to the risk element, yes, Councillor Baxter's absolutely quite right that in terms of the radon areas affected, then Midlothian is very much within that area, as it is for mining activity generally as well. I think in the provision of things like ground source heat pumps, or where there's a substantial boring down into the land, it certainly is something which does need to be carefully looked at, because the issue is with all of this, and it's the same with new buyers, it's the source, the pathway and the receptors. And in a sense, what Councillor Baxter is referring to is quite right, is where you provide the pathway potentially for the link between the source and the receptors, which is essentially housing and anything else on the surface. So I'm not aware of a lot of academic work that's been done in relation to that. I can certainly research that further. But if we are going to go down the route of ground source heat pumps in a major way, then it will be a factor which we would need to consider.
Thanks very much for that, Ian. I'm just wondering have we progressed at all in the monitoring of radon gas? Because it was some time ago that it was publicised that the monitoring would start. Obviously, whatever else we're doing, those monitors will be out there collecting information, presumably?
I think we're best if Adele Ryan is here, and maybe best to give best information to members, and Adele can pick up on that.
Sorry, excuse me, thank you. Sorry, I can certainly update you in relation to that. The first round of monitoring in relation to radon has indeed been conducted, and we do have the results in. Now, if we remember when the original or the revised radon maps were published, Midlothian certainly showed a tranche of the possibility that we would be, may potentially be severely affected by naturally occurring radon gas. Sorry, excuse me. The facts of the matter have been that the results that have come back show that there are very few properties which have been affected in terms of the first tranche of assessments. However, from the authorities' point of view, we wanted to take a very conservative approach and roll that out to a second batch. But we took some comfort from the fact that the first number of premises that we inspected and had tested, formally tested, came back in single figures. And of those, the vast majority of those, there are two different levels in relation to radon, where the lower level is if you're potentially a smoker, and the higher level is for a different lifestyle. The vast majority that even failed came back on the lower level. So I think that gives us some degree of comfort, but we still would wish to follow that forward and make sure that we have the correct information available.
Okay, Brian.
Chair, if you allow me to ask a question on something that's actually not in the report, I just think that's a bit of an omission because it ticks so many different boxes. The development in my ward in Mayfield Industrial Estate at Newton Grange, the RISE operations that opened in January. I know that's this current quarter, but obviously there's been a lot of planning in that involvement, a lot of discussions with the impacts on tourism, commercial impact, recreational impact, health impact, the cycling impact, which is going to be the main attraction to it, and this major development Obviously, you know, I just wonder how this impacted on your division, and I suppose how did we manage to miss the licensing issues of that? And if Adele was wanting to comment any more on the health and safety issues that have been, the 21-day notice, I believe, has been put on the place, I'd be really happy to hear any other comments on that. But because it is very much welcomed by the communities, you know, it is a major development in the area, and proven to be a very popular attraction. And I'd just like to hear more about how this came through your division, and what the community is all asking is, when's it going to open again?
Yeah, I'm quite happy for you to answer that, but if there's stuff you would rather take offline, then feel free to do so. I'm not sure if this is the right place for that question at this stage. However, if there is any light you can throw on it, we would appreciate it.
Thanks, Chair. And I can give an overview. As Councillor Bott just said, it probably will figure in the Q4 report, because in a sense it's only in January in Q4 that it arose, so it wouldn't appear in the Q3 report. In terms of community economy service, I can't comment on licensing. It's not part of my remit. The areas of my remit which it covered were planning, building standards, environmental health, and I'm happy for Adele to give any update on that, knowing far better on the environmental health side in detail. I think in overall terms, absolutely right. Inward investment that comes to the area to provide jobs, to provide facilities, to provide opportunities, leisure opportunities for local communities and beyond, to be welcomed. I think that we had to work through the planning issues of that type of use coming into an industrial area, but that's not unknown, and there are examples of types of non-industrial uses, if I can put it that way, in certain parts of Midlothian. In relation to building standards, there's the standard approach in relation to whatever building warrant is required, and either the structures provided either meet the building standards or they don't, and that's a fairly straightforward process of seeking a building warrant and then ultimately a completion certificate. In relation to the environmental health side, then I think that's the one that's impacted most upon the service. It's had, because our public safety team has had a lot of involvement. Obviously, it's been quite high profile. There's been a lot of press interest as well. So, not surprisingly, there's quite a lot of time being spent with the operators in relation to that. So, probably that's about sum total what I could say at the present time. Obviously, it's an ongoing situation. I don't know, I don't have a date for when the facility will be wishing to reopen. But in terms of working with the operators positively to try and get things so that they're sorted and they're in a position whereby that can reopen. Yes, clearly we wouldn't want to keep a local business from operating for any longer than we would want to. But I don't know if Adele wants to add anything on the environmental health side.
It's probably inappropriate to talk in any detail about the improvement notice that was served, so I won't really, if that's acceptable. But I can say we're within the 21-day period. There is extensive negotiations with the business operators who are now very actively involved, and we would anticipate having a positive outcome at the end.
Thanks for that, Adele. I'll just remind members that whilst there isn't any press here, this is recorded and it's available to the public, so sensitive information. If members want that, can maybe take it offline and Adele will supply maybe a bit more than what she's willing to do at a meeting that then goes public. Any other questions? Ian, I just maybe have a comment and a question. It's just when you actually look at your performance indicator summary, and when you open that 11 performance indicators, you have 7 red. It's no so hand that we would hope to see here. You would actually hope that these performance indicators will start to get better. However, probably the one that I would just like some reassurance on, because it's quite worrying, is on page 62 of the report. That's the bottom, and it's the revised child poverty action plan, and this is supporting financially vulnerable households in the current economic climate. You can see we've only got 10% there, a revised child poverty action plan. This is off target because we're saying that work's not being currently undertaken because of loss of staff. You talk about the new poverty grant stream application will help address child poverty in Midlothian. Can you give us some more reassurances on that? Because this is an area where I thought with the current welfare reform we would have been really strong on ensuring that youngsters weren't held in child poverty because of the actions of the government.
Yeah, I give assurances on two grounds, really. First of all, in terms of the issues which have been holding us back, we now have the new senior communities officer in place, and I've every confidence that he is going to, and the team that we're going to build around him is going to be active in addressing that. So we are now going to see progress on that. It's also the case that we do have a welfare rights team who are very active in supporting individuals and actually their families. And they do pick up quite a lot of issues in relation to trying to support attacking and dealing with child poverty. So in terms of the broader front, then I'm hopeful that there is support there. But in terms of the specific issue of working on the plan and the actions related to it, then we now have someone in post who is able to take that forward.
Ian.
Thank you, Chair. Just very briefly, I'm looking for a definition here on page 72, the very last item. The percentage of food premises deemed, then quote, broadly compliant, unquote, with the food hygiene legislation. I know that we're missing the target, but not by much, but we're still talking about 1 in 5 not being broadly compliant. What exactly does that mean?
Thank you. Broadly compliant is defined in the framework agreement which exists between the Food Standards Agency and the local authorities. And it is very much what it says. It's broadly compliant. It's an assessment which is made by an officer at the time of inspection of the premises. And it's not favourable to say that they are fully compliant because things can change very rapidly in the food enforcement industry. Excuse me. Each premises that is inspected in terms of a risk assessment basis is assessed at that day on that time. Of course, if a premises is not meeting its obligations, there are further interventions which take forward with the local authority. But we don't, in terms of the officer's inspection, to improve this situation within the premises. But we don't, thank you, Ian. Apologies, I'm a bit squeaky. We don't reassess the broadly compliant on the basis of reactive work that they have taken just following our improvement or our business with them, because we want to make sure it is sustained, so we don't assess it again until we do our next unannounced visit, which may be 6 months or indeed 12 or longer months. So members should be reassured that there is interventions taken where premises are not broadly compliant, but it doesn't necessarily reflect until the next inspection. Of course, premises are also coming in and going out of the system all the time, and often we will find that new businesses need a lot of assistance to get them to a situation where we would say is broadly compliant, because we want to see a continued pattern of sustained attainment rather than just on one visit.
Thank you. Any other questions for Ian or Adele? Okay, thank you very much. We now move on to item 5B3, which is education. Mary.
Thank you, Chair. The implementation of the 600 hours has gone well for 3 and 4-year-olds, and the eligible twos, at the start of writing the report, we had 41 families had taken up the place. As of this morning, there's 72 children have places. We've implemented a Scottish Government policy. However, what this has done is created an increase in nursery staff in Midlothian, and it's also increased opportunities for progression to senior CCW, and we're looking at other progression for staff as we go forward. The Big Bedtime Read, the COSLA Awards is tomorrow night, and we've been nominated for an award for the Big Bedtime Read under Tackling Inequalities, and we've actually got 2 parents going from the area, actually not delivering, but they're going to the award, and they actually delivered to COSLA because it was about parents and their learning and their needs rather than us. The early years vision has been developed and we're taking it to consultation, because if you recall at the beginning when we talked about early years, what we put in Midlothian was for 2 years only, so as that we were meeting the needs of the Act. However, we wanted to make sure what we were putting in was meeting the needs of our parents in Midlothian. So there's a review going on at the moment, and we anticipate that we'll be able to report something next quarter. It might not be complete, but at least we'll have an idea of where we're going. Raising attainment, you know that Peter McNaughton, his whole agenda for the last 2 years has been raising attainment and improving leadership within Midlothian. So instead of us from the centre saying these policies have got to be implemented, it's had devolved leadership looking at head teachers and school staff developing the programmes and policies. So there are 4 key groups being led by head teachers driving improvement forward. Grace, the new head of service, starts with us next week, and Peter will move on back to Education Scotland. We've made significant improvements in positive destinations that's been reported at Council, has been reported in a number of ways. I know that Councillor Muirhead, you're always concerned about, do we just have the big bang once a year and then we forget about it? And no, it's not. It was previously reported twice a year in the November, and then there was a census again in February. However, as we move forward with the STS, it's actually continuous assessment that's going to take place. So again, that's going to be a huge piece of work, actually continuous monitoring of youngsters who have moved beyond school or college. This is significant, but we have a new team in place. It's led by Annette Lang and Heather Fleming. So really positive work being done so far. Somehow I seem to have lost my challenges. I don't know if anybody else noticed that. We go to page 1 to page 4, but I'll just make up some challenges myself. The implementation of the named person, Joan alluded to that. This is a huge piece of legislation that is going to... we will have responsibility in education from children from entry at school age, so it could be 4.5, it could be 5, until they're 18. And then for looked after children until 21, or advice and support till they're 24. This is huge. We need systems that speak to each other, so we're looking at that at the moment. We're doing staff development and training. I'm confident that Midlothian will be in a position to implement the named person next year. However, we need to make sure the systems are in place. So CMIS needs to talk to... CMIS is the education system. It needs to talk to Framework I, that needs to talk to health services. So when they pass children on when they become 5, that needs to be talking to each other. It brings in a whole lot of other children, or home-educated children. It brings in children who are educated out with the authority in private schools. It brings in gypsy travellers. So there's a whole area there that is not just about, it's when children come to school. It's this wider area. Another priority challenge is sustaining the positive destinations, so there's work ongoing there. You'll be aware the supply teacher issues that we have across Midlothian, getting supply in where we need them, and of course next quarter we'll be reporting on how we're going to approach the maintaining teacher numbers, because instead of being measured once a year, again will be measured during the course of the year. So these are all challenges that are facing us as we move forward. I'm happy to take any questions.
Thank you. Questions? Comments? Jim?
Congratulations on your success in increasing the number of families that have taken up the place for the entitled twos. I'm quite surprised to hear that this morning, that 41, we've gone from 41 up to 72. I'd be interested to know how we've managed to make such a change. I have to say that I have been sceptical, maybe cynical about this policy, and since it was, particularly with the timing, if you remember, when it was introduced in the run-up to the referendum, when there was some difficulty in getting women to to sign up to the independence issue. You know, it was certainly sold as a way to get people off the benefits and into work, but from what I understand, the way it's working, there's no compulsion whatsoever for people to do anything once they've dropped the kids off to the nursery in the morning. They can go back and watch Jeremy Kyle and nothing that anybody can do about it. Now, if in that circumstance, you know, I understand when it was challenged during when it was first mooted, the rationale for funding it was that the tax take that we're going to get for all these people that were going to go back to work. And now, I just find that there's an inconsistency with that. And the other issue that I have with it is that, you know, to target these individuals, you know, that's particularly why I'm asking Mary about the efforts that have been made here. There's a dead easy way to target entitled twos, and that's simply to do it through the DWP and determine who's entitled to do it. But we're not allowed to do that. We've got to advertise. You know, you're talking here about work ongoing to publicise the entitlement, and it's going to be distributed a Midlothian leaflet. A lot of effort and work to be done to encourage people to take up something that we should be able to target directly to them and offer them it. Which is probably why I think, I can't remember the exact figures, you'll be able to help me, Mary, but you were talking about there is a probable entitlement to somewhere like 200, but we're only budgeting for getting 70 odd. These figures might need to be corrected. We're only budgeting for 70 odd because that's what we expect to take up to be. And in fact, we had a lot less than that. We're obviously getting closer to that expected figure for the budget, although there's a lot more entitlement there. So I would be interested to know what effect, what has managed to increase that so dramatically over that period of time. The other question, I'm in cynical mode today, is the named person proposals here or intended policy. You know, you're saying it's a huge thing, and I'm wondering if it's, at the end of the day, I'm asking the question, is it really worth the effort in terms of, is it a sledgehammer to crack a nut? I've always felt that you know, I've not had enough convincing done to persuade me that it isn't a sledgehammer to crack a nut, and I know that it's not popular with a whole swathe of people who see it as government interference when it doesn't have to be. So, you know, just maybe some comment on that. And is it adequately funded at the end of the day? Because the way you're talking there about the challenges and you know, it's a huge effort that's required to implement this. Is it being adequately funded?
Okay, thank you very much, Councillor Muirhead. I will start with entitled twos. There's a whole range of entitled twos, so it's workless households, parents in receipt of benefits, certain benefits, children with disabilities. So there's a whole range of children who are entitled. It used to be called the workless twos, but we didn't stuff children up to chimneys anymore, so the name was changed to entitled twos. A huge amount of work's gone on in Midlothian. You know, we've met with the health visitors, we've met with social workers, we've met, you know, with nursery staff, you know, in the lead up to this for the youngsters. And although it seems a dramatic increase, it has been progressive. So the last quarter we reported 41, but other people had, you know, made their requests. So it has been kind of led in over the last 3 months. So in terms of the entitled twos, we want to progress that. You're right, it is, I don't know the exact figures, but I remember we reported to Council it was in the 200s. It was about 210, but I wouldn't want to be held to ransom on that one. But we didn't have enough information. We couldn't get that information. So we reckoned it was about the 200. In terms of the named person, I couldn't possibly comment about a hammer to crack a nut. However, this is the way the legislation is going, that everybody will have a named person. Now, in a school, there was always a named person. You either had a head teacher who devolved it to a guidance teacher, or in a primary setting you had a head teacher and principal teachers who, you know, looked after the needs of children. The big difference here for the named person is Joan, although there was a reduction in child protection, we still had over the year 422 IRDs. So that was 422 referrals that we got from various places that there was a concern that may or may not be child protection. And once we've had the discussion, we've decided, no, it's not child protection, you know, either it's multi-agency or single-agency requirement. But over the year, there's still been 422. Under the named person, these referrals, instead of going to social work, will actually go to schools. So this is what I'm saying about our systems need to be in place. So these referrals will go to schools. Now, what happens just now is within social work, we get the referrals, we have the discussion with health, police, social work and education. We have that discussion. These referrals will go to schools. So we need to work out the system for doing that to make sure that nothing is lost within that system. Also, it gives the head teacher, and it's not even it gives the head teacher the responsibility that if they've got a concern about a child, they can pull in a multi-agency meeting. Now, in a school, in a leafy suburb, if there's any of those across Midlothian, you may get 1 or 2 a year. You know, 1 or 2, you know. But in a school, in an area of deprivation, as in, say, Woodburn Primary, or currently Lawfield, Gorebridge Primary, the head teacher could have a revolving door. So we need to think of systems that aid the head teacher, that they're not having a revolving door. So we've always had in Midlothian locality forums that were held every 6 weeks. We now need to hold these much more regularly, and if there's an emergency, a head teacher can call a meeting. But you can imagine your staff are going to be going all over Midlothian if each head teacher decides to call a multi-agency meeting. You're going to have to call on a social worker, you're going to have to call on a health person, you're going to have to call on the police. So people are going to be going across Midlothian. So we have a system in Midlothian. It's about how we make that system work to the benefit of the head teachers, work to the benefit of the staff. The other big area is during holidays. So are we sure that the system we put in will not just go to schools and then would lie there for the period of 6 weeks? Now, we know that we wouldn't let that happen, but do you know what I mean? These are the things we've got to think about. In service days, where will the referral go if the head teacher's away on, you know, combined training and things? So there's a lot of work to be done. And the other big bugbear is funding. Education is getting a very small piece of funding because it's reckoned by somebody that we only need to train people in this way of working. We only need to train the head teachers. Health are getting a whole lot of money for new health visitors, because they're going to be the named person and whatnot. So they're going to get money for new health visitors across Scotland, and there's a big bit of funding going into health, but a very little amount of money. Now, bearing in mind when it comes down to how much Midlothian gets, we get 1.8 to 2% of any funding that comes, and yet we could be an area that has much more need. So there's a whole lot of issues that we have to work out over the next year, and it's going to be no mean feat. But we have people in place that are moving this forward now. But, for example, CMIS isn't ready to move forward at the moment. So that's the school recording system. Framework High, we've talked about Mosaic, and we need to implement Mosaic, and the computer build for that is taking a bit longer than expected. So there's all of these things have to come together that by August next year we can implement the role of the named person within our schools across Midlothian. Hopefully that's it.
Any other questions, Brian?
First of all, comment. I mean, I've seen in health and social care how the computers can't talk to each other. you know, and they'll think need to know kind of basis, and sharing confidential information. And as Midlothian Council, we've got Midlothian Council's computers that talk to our Education Division computers. You know, there's no one joint service, and bring it together is big headaches. But my overall point, sorry, I was going to make was on teacher numbers. I'm hearing a lot of things off line that retention, recruitment, and teacher numbers is a major challenge now. And it's not just a Midlothian kind of question I'm hearing it's a Scottish-wide kind of question. Jim's sitting there with his EIS pen too. But if you could you elaborate me more on that? Do you see that as a challenge within Midlothian?
Yes. At the moment, in terms of supply teaching, there is a problem in getting supply teaching in Midlothian. Now, we're working across the board. We're working with our head teachers to be looking at staff. We had a meeting in January that Kenneth and I both attended to kind of say this is really important, and how do we work together? How do we get ideas about retaining staff in Midlothian for supply? So that's a piece of work that's ongoing at the moment. In terms of the sign-up to maintaining teacher numbers, that will be a challenge for every local authority, not just Midlothian. We need to work out, and there's no system as yet, we need to work out how it's actually going to work. Normally it was one census day and that they counted the numbers. Our understanding at the moment, because it's not clear yet, is that there's going to be 4 times in the year that you're going to be measured. And are you going to be measured on your number of vacancies? Are you going to be measured on number of staff that are off sick? Are you going to be measured on, what exactly are we going to be measured on? And what will the punitive bit be because we've signed up to these numbers? However, what I would say is there's always been that provision about teacher numbers. There was always this thing hanging over us. If you reduce your teacher numbers, you could lose £40,000 per teacher. So that's always been there, but just never enacted. So it's about how this is all going to work out. So there are high-level discussions, across the board. But it remains a challenge in Midlothian and across Scotland indeed.
Okay, thanks, Mary. Any other questions or comments?
Yeah, I'd just like to comment. But could you tell me, we are getting fully funded for the amount of teachers Midlothian is supposed to have by the Scottish Government, yeah? We just don't have the teachers that are being recruited. So you're funded for it? Yes. Yeah, just like every other local authority in Scotland? Yes. Yeah, okay, thank you.
Any other relevant questions? Okay, Mary, thank you. And that takes us on to item 6, the audit of environmental health food services. Is it Ian or Mary?
I'll do it. My husband would say I could shout loud enough. This is the audit of the Environmental Health Food Service, and Section 1 outlines the purpose of the report, and Section 2 outlines the background. The Food Standards Agency Audit and Assessment audits the local authority's conformance with the statutory requirements, and a full audit was undertaken carried out in July 2014. Section 2.2 sets out the audit requirements. Section 3 outlines the areas of importance, such as risk, resource, equalities, priorities, etc. And Section 4 sets out the recommendations.